Hello, everyone. Happy first Pull Up a Seat of the year. It's March 17th here. Happy St. Patty's Day. We are so delighted to have you joining us today. We have an incredible group of patient experts and also an incredible presentation on fertility that we'll be sharing with you. As we continue with our conversation, please feel free to write in the chat. This is a safe space, so put that in any questions you may have, and we will be sure to answer them or have our patient experts answer them. If you haven't already, please let us know where you're zooming in from, and we are delighted to have you in this space. So today I'm going to introduce myself. First of all, hello, Shonda Cooper. I'm with the Tigerlily team, program director for our policy, inclusion, and care department. Very excited to be able to welcome you to this Pull Up a Seat. This is, I believe, going into our second year of doing Pull Up a Seats, and it's become such a really great space for bi-directional conversation between patient experts and patient experts as well as healthcare practitioners. So welcome. I'm gonna give a little bit more background on Pull Up a Seat, and then we're gonna hear from Dr. Percy Spey and hear from our patient experts, hearing their story as it relates to breast cancer and fertility, their journeys. And then we're gonna have a conversation within this group discussing more in depth about this topic, followed by some feedback, interaction, and the way forward. So the 5 agreements, how to be in conversation. First, ask you to please monitor your airtime, speak your truth, speak from your own experience, lead with curiosity and not judgment, and most importantly, keep this space safe. Our why do we do this? Why do we have these conversations? We have these conversations and we gather for individuals like our angel on the left, Shantae Randall, who transitioned, but we continue on her legacy to help to educate, advocate, and empower young women, supporting young women before, during, and after breast cancer. Our mission at Tigerlily is we envision a future where breast cancer diagnosis does not inspire fear, but it ignites hope, a hope for a future. And in fact, this year, our theme for the year is hope. And how do we help to provide support, continuous support to our advocates, listening to what it is that their needs are, and being able to adjust our programming and projects accordingly so that we are serving our community and serving those that are most in need. And we continue to do this in collaboration with a lot of our different partners, including Iris Collaborative. We have reached over 200 million people from rural to grassroots and global communities through our various disparities initiatives. So as I mentioned, Pull Up a Seat. What is Pull Up a Seat? Pull Up a Seat, we started it 2 years ago, and there was, I don't know if you'll recall, there was this a conversation that took place and a speech, actually, I believe it was Rihanna, gave at the NAACP Image Awards, and she said to her white friends, to those who were, weren't Black, hey, if you're really focused on social justice, pull up and be a part of it. And so we also said, we're saying pull up a seat, be a part of the conversation as it relates to health disparities, as it relates to racial inequity and to health inequity, and listening to these conversations, taking away and listening to what our patient experts are saying, and being able to apply that within your spaces of work and within your different organizations. And so that was how Pull Up a Seat was developed and created. It is co-hosted by Black patient experts and a medical professional, again, to help to amplify Black women and women through candid conversations. So I'm so excited today to be able to introduce to you our 3 patient experts that we have, Morgan Mitchell, Cotilya Brown, and Lashelle Scott. I would like to give their introductions, but I think that they are able to do that most in their voices and in their being able to share that. So I'll just give a very short one, and then we will, hear from them in more depth after we hear from Dr. Percy Spey on oncofertility and what that entails. So Morgan Mitchell is currently a biochemist and assistant professor at Salem University. Her Morgan, welcome, and we're so glad to have you here. Cotilya Brown is hailing and coming in from Alexandria, Virginia today. Her breast cancer story started in 2019. And Cotilya, we're so excited. Thank you for coming and sharing space. And we look forward to hearing more about your experience, your story, and being able to help to create a space for you to be able to share your platform and share it in this area. So thank you very much. And last but not least, Lashelle Scott, who is also in Houston. Welcome, Lashelle. Lashelle was diagnosed with HER2 positive invasive ductal carcinoma with the BRCA gene on February 14th, 2021. And we are so delighted to have you here, Lashelle, to be able to share your story. Thank you for being advocates, angel advocates, and also being able to, be here and provide this conversation to those who really need to hear it. So I'm going to now stop sharing my screen and pass it over to Dr. Percy Spey, who will be giving a presentation on oncofertility. After that, we will hear more in depth from our patient experts.
Perfect. Thank you so much, Shonda. So let me share my screen here. And it is going to be, so I'm just going to do just a short 15-minute kind of presentation on what oncofertility means. Sometimes we talk about fertility, but what does it mean, when we talk about oncofertility? So my name is Dr. Percy Spey, and I am the Diversity, Equity, and Inclusion Program Manager at Tigerlily Foundation. So the programs that are under our DE&I umbrella are the Inclusion Pledge, the Race Alliance, Pull Up a Seat, Twitter chats, and the barrier toolkits. And what I'd love to do is to invite you to continue this conversation with me, build resources out with me, and focus on this topic with me by signing the Inclusion Pledge and then getting involved with our Race Alliance. This is something that is very important to me among other important topics. So I would love to have other like-minded individuals who really feel passionate about this topic connect with me after this session. I put the QR code there and also some links, but you can also just reach out to me. Anyway, honestly, whatever works best for you, let's connect. So what is oncofertility? It's really bringing that cancer piece, that oncology piece, and fertility together, because we're not just talking about fertility. We're talking about a specific type of fertility under a specific situation and definition. So when we talk about oncofertility, it immediately cues practitioners and individuals into this specific type of fertility that we're talking about. So when we look at oncofertility, we can see that there are best practices for women. And there's men on this list too, but what I want to make with this the point I want to make with the next two slides are that the NCCN and then also other organizations have a best practices on what should be discussed, what's happening, but we're not necessarily seeing that reflected because we have individuals who are saying we never even had a conversation about fertility, and we'll talk about reasons why that happens. Even ASCO has guidelines about fertility preservation, and in that guideline, it's the discussion should be happening, with both men and women should be happening before treatment is enacted. But what we have heard from patients is that it was never mentioned to them, or they were told that, no, it's just not an option for you. We're going to treat you instead. So they don't even have the opportunity to say, no, I would like fertility preservation, or I have all the options, and no, I'm not going to be doing this because I'm going to move forward with treatment. So although we have those recommended guidelines and the literature reflects that we should be having conversations and giving out information and resources and connecting patients to different options, it's not necessarily happening for all of our patients. So when I talk about oncofertility, one of the big questions is, well, how does my treatment even affect my fertility? Why is that an issue? Why is this a conversation I need to have? Some people just didn't know that they may not have the option to have children after treatment because, again, it was never talked about. So with different treatments, these are some of the things that can happen. And again, more of what can happen. So just infertility is a potential side effect or cause of treatment in several cases when we get treatment for our cancer. And when you're not approached with the option or the discussion of what could be done to mitigate the infertility, or even that infertility could be a possibility, it changes the trajectory of your life in a way that you weren't considering. So barriers to those conversations, and the one that I hear most is the bias. So a lot of individuals said that they never had the conversation because their doctor determined that they were too old to have children. Well, the doctor doesn't get to determine at what age you are too old to have children. I'm 35, I still plan on having more children. You know, women now, what we used to characterize as geriatric pregnancy is now just everyone is having children at that age now. It's normal. So that is, I think that's one of the most unfortunate feedback stories that I hear is the doctor determined that I was too old, or the doctor determined that I wouldn't have this option because treatment was more important. Well, you know, we need to allow patients to have that opportunity to say no, to choose whether they would even want that treatment if they're, you know, currently pregnant or actively trying to get pregnant, or what the options are around that. So these are some of the barriers that happen. And these are some best practices. So once you get the diagnosis, there should be a list of steps that we go through. And if preservation is something that the patient wants, they should go to specialists, discuss their options, and then go through those preservation options and then proceed with treatment. Now, I mean, if we give out the information and someone says, no, I want to proceed with treatment, that's fine. But the option and the discussion needs to be there, and it should be offered several times. The discussion should happen more than once, because initially everything is overwhelming. There's a lot of information. It may not be in the forefront of an individual's mind at that moment when they have that diagnosis, but eventually they will come around to that thought of, well, I never thought about if I wanted to have children, or if I wanted this as an option. Let me think about it. Now that I have my diagnosis, I've maybe done some research. Let me have a chance to even look at research of options with fertility preservation and see how I feel about it. So it should happen several times before treatment. These are some of the options. Another barrier that we kind of looked at in the last slide was that the knowledge isn't there. So you may know that fertility preservation is an option, but then what are the options? I mean, we just say fertility preservation as a large umbrella, but within that umbrella, there are several different options. The last one here, the hormone treatment, that one research is kind of showing it's not very effective. So I do include it because it is something that could be discussed with a practitioner could bring that up, but that I would say the research behind that is not really showing that it's successful in protecting the fertility piece there. So I would say that out of these options, if you ever hear of the hormone treatment, do more research on that. And I just included that as well because you may hear that, or you may have a friend mention that, and then you will know what it is. And then you can say, actually, wait, let's do some more research on this, or you can ask more questions on it. So there are several different options here.
Dr. Faye, can you can you go back to that slide? Is it possible for you just to explain the different options?
Yes, sorry. I'm not reading the slides because I know for the sake of time, but let me go back on that slide. So egg freezing. So that is the process where the eggs are removed from your ovary and frozen. I think that is the egg and embryo freezing we're the most familiar with. You know, when I think of fertility preservation, that's what I think of. But there are other options as well. So embryo freezing, that's when your eggs are removed and then they're fertilized. It becomes an embryo. They freeze that for future use. I have read in the literature that embryo freezing is more successful than egg freezing. But again, I encourage you to research the statistics on that. There's ovarian shielding, and that's where just a cover for protection is placed over the ovaries and reproductive system. And that kind of shields that area from the radiation in treatment with that specific treatment. Ovarian tissue freezing. So this is experimental, but this is an option that they're looking into for young girls who haven't gone through puberty yet. So previously there were no options there, because they, they don't have mature eggs. So this is still experimental, but there is some sort of option for very young women who are, going through the cancer treatment process. The ovarian transposition. So that just moves the ovaries away from the part of the body that may be getting that treatment. And that's specifically for radiation treatment. And then we have the removal of the cervix, and then attaching it to the remaining part of the vagina. That would be with cervical cancer. And then we discussed the hormone therapy, which the literature is showing that that is not, that's not very effective. All right, so cost. So when we have the fertility discussions or the oncofertility discussions, another thing that I notice is we're not very familiar with, because it varies so much and insurance varies so much. The cost of fertility preservation is usually around 10 to 15,000, and that's just for the service. The storage will be depending, it could be a monthly or a bi-yearly fee. I have heard that a lot of insurances do some sort of coverage, and I've seen this change in the last maybe 5 years. I think there's even it's called something like Carrot, or there's some sort of special umbrella term I know that Cigna has now that goes to fertility. It's not specific to oncofertility. But the majority of insurances do not cover fertility preservation. You have to check with your plan. And I think it would be helpful to put together a list of specific plans that do and don't, because I know Cigna does have something now that they enacted. It was just last year to help with fertility preservation. And then I would love to see just a differentiation between oncofertility and fertility, because this is something that we have to have our treatments now. We can't wait. It's not it's not something that we have a lot of time for these discussions to develop around. And I did put a link here for further financial assistance. If you are working in this field or you're advocating in this field, this is a really good link for individuals that you can pass around now. So I have also heard individuals who, especially, and this was even in the Twitter chats, who the conversation didn't happen with them. They went through treatment, and creating the family that they had in their mind is no longer an option. So we need to be really sensitive to individuals who were on the wrong end of this, right? Who did not have that discussion, who did not have the opportunity to say yes or no. And I just want to present that there are all forms of building families. Yes, there are the forms that we typically know, which is natural conception or the assisted reproductive technology that we have. But there are also donor eggs and embryos, donor sperm that potentially we could still carry and build a family, use it through that method. There's adoption. There are other ways. So when we present with it, with an individual who is, maybe saying, I wish that I had those options. It's, now I can't have those options. I think it's important to recognize that there are still options that are valid ways to building a family that we may have always wanted to build. And these are my resources. I do have several resources here that are of assistance. Is anyone here, if you could raise your hand, is anyone here actively working with advocacy in this specific program or having these conversations with anyone? I don't see any hands. And I think that is an important piece of feedback there. It's a conversation that amongst us needs to happen more. I think a lot of times we don't even remember that this is a piece here. Or is there something in the chat? Let me check. Yes, I will share the links. I will share the links. I'll share all of this. Oh, and I see feedback. So insurance did not cover egg preservation. Yeah. Storage fees, prices in here. All right, so this is what I have here. I'm going to share all the links with you. And if you want to connect with me online, you can scan this with your phone, or I can link this again, but I would really love to continue this conversation with anybody that's interested. If you sign the inclusion pledge, it really is, we're already working to action barriers down that lead to health inequality. And what we'll be doing later in the year is also having a Race Alliance meeting. When you sign the inclusion pledge, you're part of the Race Alliance, which is a coalition that actions breaking down the barriers. So we will be doing a meeting around oncofertility, but also sexual health, which is another piece that I don't think gets enough coverage in terms of the journey before, during, and after cancer. Shonda, can I turn it back over to you? Any questions for me?
Absolutely. No, this is great.
I tried to, I was getting up to 14 slides, you know, when I was putting it together, and I was like, no, let me not do more than this. I could have gone on forever because there's so much here that I feel really passionate about that I think everybody needs to know.
No, this was wonderful, Dr. Faye. Thank you so much. It's extremely informative, and being able to understand as well about the combination between oncology and fertility, this oncofertility, niche, and the importance of being able to understand that as well as different options. So it was extremely informative, and I think it'll really help to guide our conversation discussion as we dive into listening to our patient stories and then having an interactive conversation with those who are on this call. So thank you for providing that educational component and setting the stage, helping us to be familiar with those terms, as well as those resources that you're going to provide in the link in the chat that we can also follow along with. So thank you for that. I am going to now, I'm super excited to be able to pass it over to our first patient expert who will be sharing her story, Morgan Mitchell, and then we'll hear from Cotilya Brown and then Lashelle Scott. So Morgan, welcome and thank you.
Hey, I'm so happy to be here. Thank you for having me. So my name is Morgan Mitchell, and I got diagnosed with stage 1 HER2 positive, ER positive, PR positive, or also known as triple positive breast cancer. And it's really sort of like a different story. I call it divine design because I was 34 years old, and I just happened to brush across my breast and feel something. And then the first day I shrugged it off. And then the second day, I just happened to brush across it again. And I showed it to my mom. She felt it. She said, go ahead, make an appointment with your OBGYN. I did that. And my OBGYN said that because of my lack of family history and also my age, is probably just a cyst. These are very common. She was like, I've had 3 cysts in my lifetime. So she referred me to her breast surgeon, which removed her cysts. And little did I know that this breast surgeon was one of the top ranking breast surgeons in the state of Texas. So that was, again, you know, my cards just aligned on that. I just happened to be fortunate enough to do that. And so she felt the lump, she biopsied it, and 5 days later over Zoom, she told me that I had breast cancer. Now, the reason why I was over Zoom was because it was in the middle of a pandemic. And this was before vaccines. So it was a very terrifying time for me. because I'm on chemo, right? I have no immune system, and we have, you know, COVID out there, and people were dying. At this point, it was like 500,000 people had died. I was terrified. The only time I left my house was to go to treatment. I didn't feel comfortable around anyone or anything, even outside in a park. I didn't feel comfortable. I was terrified, right? And it was really hard, right? Because this is the time when you need people. Like, I just wanted a hug, you know, nobody could touch me. I was in the house 24/7. You start to feel like a prisoner in your own home. It was a very, very difficult time. However, I made it through. We all made it through, right? I went through chemo. I did a lumpectomy. I did radiation, and I did targeted maintenance therapy. Now I'm on oral cancer pills every day for the next 5 years. In terms of my, sorry, Shonda, you want me to go into my fertility story now, or?
Sure, yeah, feel
Okay.
free to do that. Yeah, please go ahead.
Okay, sure.
Mhm, yeah.
So what happened was, after I was diagnosed, you know, they give you a ton of information. And my doctor started talking about an onco fertility specialist. And this was the kind of the last piece that he talked about before I started cancer therapy. And when it was mentioned, I was just like, okay, yeah, whatever. But when I went to the appointment, that's when everything kind of set in. Because you have to remember, like, you've been told that you have cancer, like, this is a lot, right? It's already heavy. And it was really hard for me to think about, you know, fertility. I just didn't even think about it, even though I knew, you know, that chemo, you know, destroys your eggs. Again, it's so much on your mind. And so kind of that was the last thing on my mind. When I went to the appointment, that's when it set in, and I got the full information. And so my the clinic that I went to for cancer treatment, they referred me to a onco fertility doctor. And when we went through everything, it's a very, very heavy toll, right? Because you have to think, like, I'm not only making decisions now for myself, but I'm making decisions for my unborn children, right? This is not a light decision. For me, they offered the hormonal therapy, which means that which means also that my tumor was going to grow, right? Because my tumor is hormone positive, right? So there's an issue of that, right? That doesn't sound too good for a cancer patient, telling them that their tumor is going to grow, right? Also, the time was of the essence. My doctor really stressed, you know, we need to start cancer therapy. We need to start cancer therapy. And at the time, this process took around 6 weeks, the fertility process. So that was a factor, right? The cost is definitely a factor. I know the physician just presented some slides on cost, but that's really on the low base end of everything. Because you're not counting, it's about $500 for the medications before you even start. There's tons of fees. So the total cost ends up being somewhere in the 20s, right? So that's a significant amount of money. Now they also did refer me to a loan loan company that specializes, their specialty is, providing loans to people who want fertility treatment. So I was like, okay, yeah, so there's that. What else? Oh, in the end, I made the decision not to preserve my eggs. And that decision was the best for me. I was already about 80% sure that I didn't want children before I even got diagnosed, right? And then with this, all of the barriers that I just told you about, which also, and I need to say this, you want to make sure you're looking at which fertility clinics are using the appropriate statistics, right? Because a lot of fertility clinics, they'll say over 90%, 90% effective rate, 90% success rate, but they're counting pregnancies, right? They're not counting if a woman gets pregnant and has a miscarriage. They're not counting stillborn deaths, right? So if you actually look at that actual number, it's less than 50%, which for me, less than 50%, those are not good odds, right? And again, health comes into it. Like I said, now I'm making decisions for my unborn children. In my case, I don't have any genetic mutations for breast cancer or anything like that. However, my children will be predisposed to this, right? And so for all of those reasons, I opted not to do the preservation of the eggs.
Thank you, Morgan. Thank you for sharing your story and sharing your experience as well as your decision. I think one of the important parts as well is that being able to make a choice and have that choice. There are some who didn't have that, but for you to be able to have that choice and to say, you know what, this is what I'm experiencing. This is what my thought process is prior to going through this. And this is where I am, and feeling comfortable in your decision, but being able to have all the information to do that, is really so key. And so thank you for being able to share that, as well as statistics that you shared, which are really important, I think. And I know we'll definitely dive into that, because that was something too that when I went through that journey with the cryopreservation, what is the rate of thawing once you thaw the eggs? That drops significantly from what what you're being seen or what is being shared with you in terms of statistics. So I just want to thank you again for sharing that, and for the power of choice and being able to make those decisions. So thank you, Morgan. And if you have questions as well or comments to Morgan, please put that in the chat and we'll come back to them after we finish hearing from Cotilya and Lashelle. Cotilya, welcome.
Thank you so much. Thank you for having me. My name is Cotilya Brown. I was diagnosed with invasive ductal carcinoma on January 22nd, 2019. I was 36 years old at the time. Similar to Morgan, I was told that the lump that I found in my breast, I found a lump in my right breast in the shower. And I knew right away that something wasn't right. And I was afraid to, pursue it, etc. But I did. And I asked my boyfriend at the time to confirm that it was there. He did. And then I made an appointment with my primary care physician. She, similar to like Morgan mentioned, basically said, just given your age, is probably not breast cancer. It's probably just a cyst. And, but we'll do the mammogram and ultrasound just to make sure. They did that. I was so nervous about it. I was like walking around holding my breast every single day until I had the testing. my primary care physician did give me like a tidbit of information, and she basically said, just if you're that concerned about it, just go to the get the mammogram tomorrow, because I did not have a baseline mammogram because I was 36. So I went the next day, and they did the mammogram and the ultrasound, and again I was told it was a cyst. Excuse me, a radiologist basically told me it was a cyst, and that I could let it go away on its own, or I could get it aspirated, which is when they remove fluid from it and remove it from your body. So despite my huge fear of needles, I chose to get it aspirated because I just was not going to be comfortable just walking around with my hand in my shirt for like however long this thing was going to stay there. I had the aspiration appointment, I think was like a week later, maybe a week and a half later. And that time it felt like it had grown to me. Apparently it did. When I got to the doctor, she confirmed that it did. I have Kaiser Health Insurance, so it's generally speaking like a different doctor for different procedures. Anyway, and a different facility for certain procedures as well. So I went, and when I got there for the aspiration, the doctor then told me that I should get a biopsy instead. I got the biopsy, and I think 3 or 4 days later, she called me over the phone and confirmed that it was breast cancer. That got the ball rolling with, all of the things, all of the fear, the anxiety, the, oh my God, all of that. I don't have a family history of breast cancer, so that was also concerning. And I also had grade 3 breast cancer, right, which is the highest grade that you can have. Stage 1, grade 3, estrogen and progesterone negative, HER2 positive, invasive ductal carcinoma. So from there, like I said, the ball got rolling. I have Kaiser Health Insurance, so I was receiving a lot of calls from everyone, it seemed, with a variety of outlining what's going to happen next, et cetera, what to expect. Almost as like an afterthought, fertility was mentioned. It was mentioned right before I was going to start chemotherapy, and I only had 1 day to make a decision. So I felt very overwhelmed and rushed. I didn't know what to do. I didn't know what my chances would be to have a natural child if I chose not to get my eggs preserved. I did choose the egg preservation option, but that was after, like, it's almost like they had to convince me, because I knew that it was going to be very expensive. I had Googled how much that costs, and I was hearing numbers like 45,000, 50,000. And I was like, there's no way that I can finance 45,000. I don't have the money for that. They did offer like a cancer discount, if you will, which was very significant, but I still was concerned about financing it. Like Morgan mentioned, the fertility place I went to had a company that you could get a loan from, and then you could sign up for automatic withdrawals to repay the money. I didn't have the money for that either, and was still very concerned. To which at some point, the fertility doctor basically just said, if you want to do this, we're going to do this. And we'll worry about the funds later on. So I moved forward with giving myself injections every day. I think it was for a total of 16 days. And then there was a trigger day, which was the day before they were removed, I believe. And then I had the egg removal at Shady Grove Fertility in Rockville, Maryland. That's where they did it, because Kaiser does not have a fertility, I guess, department or something of that nature. So just like Morgan mentioned, it was terrifying. To be honest with you, I'm still terrified of it all these years later, just because I don't really know if I really want to use these eggs, they are there in case I can't conceive the natural way. I felt very, very, very overwhelmed with having to make that decision in like one day, and having to learn how to give myself injections. Apparently I did that. That was also a trial and error. Sometimes it was spilling out on the floor. It was crazy. Anyway, the point is, I made it through. I got that, and I had also your age comes into play. So because I was 36, the concern was, oh, you're probably not that fertile anymore anyway. But apparently I am a little bit more fertile than expected. So I they retrieved 16 eggs, and 11 of them are viable. I did not have the time to do the research, like Morgan mentioned, as far as figuring out what happens when they're unthawed and the whole process. I will confirm what she said. There is a fee for absolutely every single thing. So there's a storage fee, there's a fee for removal, there's a fee for fertilization, there's a fee for, all of those things and more. And insurance, as we mentioned earlier, does not cover all of those things. So I was able to get some of the medications donated to me, and then I paid for the rest. So that pretty much was that. So anyway, yeah, that's, I guess in summary, yeah, I have 11 viable eggs. I haven't used any of them. If I do have a child, I would like to have the old-fashioned way. I don't have, or conceive of the old-fashioned way, I guess. I don't have any genetic mutations as far as breast cancer is concerned. So I have environmental breast cancer. So I was not positive for BRCA1 or 2. But my oncologist pretty much heavily suggested that I do this. And it was, like I said, a very last minute thing. And the day after I had the egg removal, I think it was either 1 day or 2 days later, I started chemotherapy. So everything was a very quick process.
Thank you, Cotilya. Thank you for sharing that, and being able to, your experience, as well as your choice, your decision that you had to make in 1 day. That it's, and I think, we'll definitely talk about it more, is these having to make these major decisions in a short period of time that can have, that has a lasting effect, in a time where you're also dealing with the trauma and the fear that comes along with having a diagnosis and trying to wrap your mind around that. And like for you, like you were talking about, a fear of needles, and then here you are having to now like give yourself injections, not once, maybe twice a day, before starting. So it's just, thank you for sharing that, as well as your experience with the cost barrier, what was available, and what, was made possible for you to be able to make that decision and make those choices. So thank you again for being here, for sharing space, and for your openness to talk about a topic that sometimes we don't really talk about too much, but it's so important for us to share this. And, we're able to provide information to one another, inform each other, as well as, hopefully being able to, just shine a light on something it's very important and really real in our community. So thank you, Cotilya. And I'm going to pass it on to Lashelle. Welcome, Lashelle.
Hi, good morning, everyone. My name is Lashelle, and I was diagnosed February the 13th, 2020, where we're in 23, 21, 22. And like Morgan, I was diagnosed right during the height of COVID, and also our power grid failure here in Texas. So imagine waiting to hear back to find out if you have cancer in the middle of a power grid failure. Mine started out as a mass, and it was kind of hard because I'm big breasted, and I have dense breasts. My OBGYN sent me to a breast surgeon who said, well, you just need surgery. They're probably just going to cut it out. And, you know, that's it. He never mentioned anything about cancer, but I knew it was something more because I started having this increased pain. I noticed one of my breasts, the breast was bigger, and I was just plain miserable and just having to wait out to see a doctor. During all this, it was a lot. I'm stage 3 HER2 positive, BRCA gene mutation, and cancer is prevalent in my family, but breast cancer is not. So unlike Cotilya and Morgan, I was never, no one ever talked to me about fertility. And I think that's one of the reasons why that I changed my oncologist. So I have a new oncologist, and now those conversations are being had. I've undergone 5 rounds of the regular what they call red devil chemotherapy. I've had 16 rounds of immunotherapy, Kadcyla. I've had a partial mastectomy. I'm going back to get the other breast removed because of the gene mutation and how quickly, you know, the cancer spread. I don't want to repeat performance. And recently I found out that I have a cyst on my pelvic area. So for me, I am deeply concerned about what's next. I actually have an appointment with an OBGYN next week, and we'll look at some things and we'll talk about those things. But I don't have any kids, but I was never given an option, and I'm learning, listening to know what's out there. Even with insurance, you know, I probably wouldn't have been able to afford it. And now the fact that I have a cyst in another region, you know, how dangerous would it be for me to actually try to have a child, or even if I can have a child now. So I'm thankful to be here and thankful for this topic. I'm learning so much, and I learned that in this dance, this journey, there's medical bias, and I underwent that with my oncologist when I began asking more questions and questioning things that I should have got or should know. She became very combative, and I ended up leaving. But I kind of wish I had known. Maybe I would have chose differently. But now I'm in a state where, I don't have that choice anymore. So if I wanted kids, I would probably have to adopt. But be your own advocate is the best advice I can give you. You only have one you. Weigh your pros and cons about having kids, especially with breast cancer, and because chemotherapy, it takes a toll on you. I'm still just having to deal with the repercussions of that alone. I had very long hair down to my back. My eyebrows have yet to come back. But like I said, now that I have this new potential issue of a cyst in my pelvic area, I'm really concerned about, you know, is it cancer? What do we do from now? Now I know that I have to be a lot more aggressive in finding out what's going on. So Morgan can tell you, I commend you for for being advocates for your own health. Like I said, that was never mentioned to me. And I'm listening to this, and I get kind of upset because only thing I just remember them, shoving all this information. You got to do this, we got to do that, and never this discussion if I wanted kids, or would you like to freeze your eggs? Do you have a surrogate? Have you ever thought about those things? Nobody ever asked me that. So, but thank you everyone that's here today to sharing your stories, because that helps a lot. And now I have information that I want to go and look at as well. for my own safety, my own health.
Absolutely, Lashelle, and thank you for being here as well, and sharing your story and what you're going through, and continue to go through. And I just want you to know too that we'll be circling you in prayer as you continue on this journey, especially with that cyst that they found. You know, like you said, sort of carrying all this information and trying to process it. And it's so important to give people the option. You know, we've heard 3 different stories here, 3 different experiences, 2 in the same city, you know, 2 different experiences. They're both in Houston. You know, Morgan and Lashelle are both in Houston. Cotilya is in Alexandria, Virginia, right outside of DC. And, you know, there are different experiences that they've all been facing as it relates to this. And I know that, you know, we have different, it's really lively in the chat because there are different people who are experiencing and can relate to Lashelle, what you're saying. Not having that opportunity, never being asked that question. And so I just want to open it up to some of the participants that are on. If you want to share, you know, say a comment or provide any feedback or anything to the women on this call, as well as, you know, Lashelle, Morgan, and Cotilya, if you want to if there's a conversation or topic that you want to bring up. I do have a few, but I want to open it up as well. I see She-Ra Sandifer on, and I'm going to pass it over to you. Please go ahead, Carla.
Good morning, Grand Rising, all of you beautiful ladies. I apologize, I was a little late. I'm on the West Coast, but I definitely understand the issues that we have and that we face. I'm going to the oncologist in a few minutes for my appointment at 9:15. I still go every 3 months to have all of my checks done. I was diagnosed in 2018. I did not get the opportunity. I felt rushed, but you know, from the medical aspect, I'm going to give them grace because they were looking for saving my life and not thinking about children, you know, because that's not for them to think about. That's our journey, you know, honestly. I was diagnosed at 38. I'm 42 now. And it's a love journey. It's a self-love journey that we have to face within ourselves, dealing with cancer, dealing with breast cancer, you know, any type of cancer. Any disease is not something that we want to deal with. It's not something that we look to deal with, but when we do deal with it, we have to look at our best interests. So, you know, I have a great oncologist. I have a great oncology team. I don't blame them for not presenting me with the information of freezing my eggs. What my doctor did say to me was that it's a high risk when you do that because those eggs may not activate, you know, and it's financial. A lot of people don't have the financial stability to pay for eggs and also fight for your life and also live. So you have to think about all of those things that you did not have. Do you want that to be a worry for you while you're going through treatment? Absolutely not. Absolutely not. If I was to worry about that, I would have manifested other demons. So I'm thankful that, you know, I didn't have that opportunity because that would have been another worry that I did not need on my plate at that time. And I can only move forward and not think about the fact that I can't, because who's to say, you know what I'm saying? I'm still alive and I still am breathing. And honestly, my eggs are still working. You know what I mean? Like I get a Lupron shot every day. They want me in menopause. I'm not in menopause. I've been taking Lupron since 39. I'm not in menopause yet. So that tells you right there, the body and God who made me is still working in me and on me. And so if I adopt a baby, a beautiful baby in the future, that baby needed me and I'm going to need that child. because God is going to bring us together. So guess what? We don't have to carry a child physically because we've already been through enough. So that's just my thought, that I'm paying forward to my sisters who are now dealing with what I've already gone through. And when you look back from now, 3 years from now, or however many years from now, you're going to look back and smile. You're going to look back and smile because you have beat the odds. Okay. And that's all I have to say. Thank you.
Thank you. Thank you for sharing that. So just thank you for that. And, bring that perspective. As you said, you have beat the odds, and, thinking of it in that moving forward and what we can do moving forward with God, knowing that, this is a self-love journey as you continue on this process. So thank you for that perspective and sharing that. As well, and especially hopping on, even though I know you're heading to your appointment, but also being able to share with your sisters. I see Rila Parker, your hand is up, so please welcome.
I'd like to share, like Carla mentioned, I beat the odds as well. In the beginning, I felt very rushed. I met with all my oncology team, they have been excellent for me. I met with them all at once in the room. I was sitting on the table and everybody else looking at me. My oncologist did tell me about egg preservation. I went to the fertility doctor, and he was pretty much checked out already because he was retiring. So of course he checked me out and said that I was healthy enough. Well, I didn't have like polycystic ovarian syndrome, and I will be good to preserve the eggs. However, my BMI at the time was too high, and I was more at risk at that facility. They wouldn't been able to accommodate any complications if they would happen. So I felt I had to make that decision right away. I always desired to have kids, of my own. And then when felt that I just had to hurry up and make that decision because I was starting chemo that next week. So went on through, my oncology team was very supportive of me. However, on the other side of that, now my eggs have regenerated itself. I am capable of having a child. My doctor laughed with me when I went to get checked, the fertility specialist. She was like, well, your polycystic ovarian syndrome that you had prior to must have helped. You still have a little bit of eggs left. I was diagnosed at age 42, and now I'm 45, and now even though it's still risky, I still have the opportunity to have a child, even though I miscarried years ago in 2010. But yeah, I'm one of the ones that beat the odds, and I fortunately have a great oncology team. They still help me out now. I just had to have a biopsy this past week to see if the calcifications are cancerous. I have a strong faith and believe that everything is going to be well, that they're going to be benign. But at the same time, if I have to go this journey again, I'll go stronger and harder.
Absolutely.
So I send love to you ladies.
Yes.
We're
Thank
our
you,
support
Rila.
system.
Yes. And we're sending love to you as well.
Thank
Sending
you.
it back as well. Thank you for that, sharing that, as well as, like you said, sort of beating the odds, right? I think it's this balance with statistics, where there's statistics saying this one thing, and then also there are situations like Carla was sharing. She's been taking her Lupron shot. She's been doing that, and she's still, her body has not gone into menopause. There's Rila who's, sharing too, that her eggs, it came back after. So there are, there are these moments, different, I guess, mindset or positivity, and just, I don't know, it's everybody's situation is different, but I hope that by hearing these different stories, as well as hearing different experiences, knowing that one, you're not alone, two, that it really is a choice that you make, and whichever choice, there's still an opportunity to achieve those goals or desires that you may have as it relates to if there is a desire to have children, that there are other options too. Like Carla said, that child, if it's adoption, will be brought to her, Rila, now at 45, her eggs, she has that, it's a possibility. So as we continue, it is something just sort of to think about and reflect on as we move on with our conversation. I want to open it up as well to those who are also on, who may also have some additional questions or comments that they want to share, or may relate to these lovely ladies. Okay, well, I have a question. I think this is a question to Cotilya, because Cotilya, you're mentioning about your experience and as related to the cost, and that your fertility, they basically just said at the end, we'll take care of it, don't worry about it, we'll figure out the cost later. And you mentioned about your medication being donated. That was one thing I think Morgan also mentioned, that when she was looking at her different options, the cost of medication can go to the thousands. So how is that medication donated? Is that something that you're able to share? Are you aware of how that was donated?
Sure. So from what I understand, at Shady Grove Fertility, someone, I guess, had, or several people, had donated medications that they either weren't using or hadn't used, or so that's how I was able to get the funds. And then, to get the medication. And then one of the nurses at the fertility treatment place, I think they have like a resource there, or either a connection or someone that they can call, like at the manufacturer, and they were able to give some medication as well. And then I paid the remaining, I think I want to say like $500 for the, there was like a trigger shot, and then there was an initial shot that I needed to take. And then there were some other pre-filled pins that I needed to administer as well.
Thank you. Thanks for that, Cotilya. So I'm just curious too, and I know that we talk about, and mindset is so important, like Carla was saying, and looking at it in that way. I also curious to hear if it's possible, just I know Morgan and Lashelle, you all are both in the same city. Where are you located in the city? And do you think that that had anything to do with it, with your experience? And it may not, but I'm just curious.
I am on the southwest side, so I'm with the Memorial Hermann Texas Oncology Group.
How about you, Morgan, when you were going through your treatment?
Yeah, so I am located in Southeast Houston. And I also went through Texas Oncology. My breast surgeon is a Black woman. So I don't feel, as though there were any biases toward me or anything.
Thank you for that. And I mean, this is also, I'm glad, this is the first time that you two are meeting, but have so many different, experiences or so in common, from being in the same city to even going through similar networks, and then having, different experiences. But I'm glad too, Lashelle, that like you shared about, not receiving the care that you felt you deserved and that you needed. And now you have a different oncologist that is giving you those options, that has even been able to, that you feel more comfortable, that you have more resources and the care that you need moving forward. And note, how long has it been since you switched from one oncologist to the next?
It's been about a month, and I actually am pleased. When I met with her, she gave me like this, I want to say it was almost 42 pages of a document of every question that you could think about that she wanted to know. And she wanted me to list out all of my family members and their kids, if they had some type of cancer, or, if I had on my mom's side, my dad's side. I mean, she was very thorough. And I was like, wow, this is like an exam. And I had to go back and think about different things that I've been through in my life. She asked about different surgeries, if I had cysts before, ovarian cysts, what do I eat? What is my daily meal looks? I mean, she was very thorough. And when I met with her for the first time, it was 2 hours long. And I didn't get that the first time. It was kind of like 15 to 20 minutes and boom, here's a big book. You read this and that's it. So I'm really happy. And she was actually the doctor that said, hey, just so we are on the same page, I want to send you to a couple of other doctors to make sure that you don't have it anywhere else, because you do have the BRCA gene and mutation. So we haven't really talked about that. So we want to address that. So we want you to go see this doctor, this type of doctor, that type of doctor. I have like 8 appointments with 8 different types of doctors in the next couple of weeks.
That's great. That's wonderful. And even, being able to have that information. I guess also one other question too, how many of you all had been familiar or heard about oncofertility like previously? I mean, not previous, but at the beginning of your journey. I know that Morgan, you were recommended to an oncofertility specialist, but was that the case with you, Lashelle? I know, Lashelle, you didn't have anybody, you weren't even told about it, but Cotilya, was it also an oncofertility specialist or just a fertility specialist? Not just, but either or.
I was referred to an oncofertility specialist at Shady Grove.
Okay. And how about you, Morgan?
I'm sorry, what was the question?
Oh, you were, when you said that you were referred to an oncofertility specialist, I was just curious if it was someone specifically oncofertility specialist or a fertility specialist. And was that within the practice, or did you have to go somewhere else to be able to get that experience?
Yeah, so it was an onco fertility specialist, and let me be clear, if you have cancer, if you're a cancer patient or about to go do chemotherapy or whatever, you need an onco fertility specialist. And yeah, most times it's
Absolutely.
outside of the practice, because this is a very specialty type of type of work, right? And I want to also mention, I looked at several fertility clinics also, and most of these, they're private small clinics. They want their money up front before you even start with anything. They want it paid in full upfront. Okay, so that's also something that I wanted to make sure I share. And also another thing I wanted to make sure that I share, it was presented to me that, if I didn't do the egg preservation, I could also freeze sperm of a male relative if I just wanted to have some sort of family preservation in that. Freezing sperm is a lot cheaper, it's a lot easier. So that may be an option for some people also.
Thank you, Morgan. It was extremely informative and helpful information. Thank you for sharing that. Any other questions or comments that you all may have for each other, or for those who are on that you'd like to share with the group? Well, we can talk about, I know as we wrap up, we can also discuss and just some takeaways that from this. I'd love to hear from each one of you experts, patient experts, there's one takeaway, if not more than one, that from this conversation that you're going to take away with you, and that you hope is also passed on to healthcare professionals, practitioners, about how they can improve on their processes, or there's some that if they've already done a good job, what they can continue to do. So pass it over to you, ladies.
I think the question was, what would we like to pass on to other ladies, right? Like a
Yes.
takeaway?
Yeah.
I have a couple, but I think the first one is something that was already mentioned, which is to advocate for yourself. If you don't feel like something is right, if someone is not treating you correctly, like Lashelle mentioned, if you don't feel comfortable, definitely speak up, because it's so overwhelming. People will blow by you if you don't say anything. And it incorporates so many different sensitive subjects that the last thing you want to do is be on pins and needles about someone's either attitude or how they're treating you, or how they're not treating you fairly. It's just an additional stress that you definitely don't need. I think the other thing is to be patient with yourself. Easy to say, right? But it is a lot. I think Dr. Faye mentioned it earlier, right? Like it is very overwhelming. I'm going to show you guys something that I have here. I compiled this binder. This is my breath, like this is all the information that I got from treatment, right? And it has like tabs, et cetera, et cetera. So getting all of this at one time was so overwhelming. I couldn't even like process or read through this. It took me, I think, until the third round of chemo to kind of just get my arms around everything. And I still didn't have it. So as far as like pre-medication, there was a mix up with my pre-meds at one point. Just a lot of things that you don't know. I would also say the last takeaway, because this is getting long, is try to find, if possible, some sort of like cancer mentor. I joined a support group at Kaiser, and that's how I knew that I didn't get the appropriate pre-meds for the first round. So one of my bigger sisters in the support group, I was telling the group like how I felt after the first round. The first round like nearly took me out of here. Like I was just barely making it, and just begging God to just let me go. I went to the hospital in the middle of the night by myself. It was really crazy. Anyway, at that point, one of the ladies in the support group was like, wait a minute, did you get your pre-meds? Like you shouldn't be feeling that bad. And I was like, no, I didn't get any pre-meds or anything like that. And so, she was outraged. And basically the next time I had the appointment, she went with me to see my oncologist and was like, hey, what happened? Like, why isn't she getting the pre-meds? What happened here? And he basically turned around the computer screen like, look, I ordered it. I don't know why it wasn't given, but we will make sure that it never happens again, et cetera, et cetera. So I would definitely say like use your resources wisely. If you can find someone that can help you navigate that, then definitely take advantage of that, because it's a lot and it's very overwhelming and it's not easy to digest.
So well said. Thank you. How about you, Morgan and Lashelle?
Yeah, I just want to say, I think in all of our stories, the common theme of feeling rushed, again, having days, literally, a few days to make such a life-altering decision. I'm not blaming one person. It's not one person's fault or another one, but I do feel as though you know, the fertility and all these things, it shouldn't be an afterthought. It shouldn't be a thing right before you go into treatment, right? I think it should be prioritized. It should be more at the beginning. I also agree, you know, the doctors, you know, the oncology doctors, their focus is on saving your life and getting rid of the cancer, right? Their focus is not necessarily on your fertility or you know, unborn kids and things like that. So I think there has to be some sort of balance in there, right? But you know, and for the people who don't get offered it at all, I mean, that is, you know, a failure on so many levels, because at the end of the day, it's my life, it's my choice, it's my decision, it's my kids, right? It's my family. So, you know, your oncology team doesn't get to decide that, what you want to do, right? And so, yeah, I think it's important. I'm glad that we're having this conversation. I think it's a topic that is not usually brought up in these types of forums, and we need to do better. We need to talk more about these conversations, and you know, hopefully people, you know, who get newly diagnosed, you know, they'll hear about this and say, hey, wait a minute, what about fertility treatment on day one when they go to see that doctor, right? So these are important, and thank you for having me, and I really appreciate this this space to talk.
Absolutely. Thank you, Morgan. So well said. Thank you. Lashelle, how about you?
Hi, I just want to piggyback on what Morgan said, you know, in the beginning, and they give you like all this information. Like Cotilya, I have a big blue binder and they just give it to you and say, here's all of the information. And there's so much medical jargon, and you're trying to think, you're listening to the doctor and you're trying to read and you're trying to ask questions. It's a lot. And the best advice, your plan can change. Mine's changed, my treatment plan changed so many times. I was supposed to just have this, and this, but then it turned into A, B, C, D, E, and F, and G. And now here I am, you know, where I'm on a treatment pill now. I thought I was gonna be done after immunotherapy, or, you know, or go to radiation or whatever was next, but that changed, everything changed. And in the beginning, when my plan changed the first time, I got really upset and I was really hard on myself. So now I just take it a day at a time, because I know this thing is a journey. It can change. If, you know, 5 minutes from now, I can get a phone call and say, hey, Ms. Scott, we have your lab results back and this is XYZ, and we got to start doing XYZ, and you got to think fast. But just having grace and space for yourself, and will keep you sane as well, is don't get too caught up in what the original plan is, because it would change. And thank you for having me. I always love what Tigerlily does. They were very instrumental in me thinking about changing my oncologist, because there were questions, like I didn't know anything about clinical trials. I was just given a plan and say, hey, this is what we're going to do. But I noticed when I start asking questions, I became the problem kid, and I was asking too many questions, and no, that doesn't apply to you. And, you know, being rushed out the office, and I'm like, this is not okay. You know, we didn't talk about heart issues, you know, from, you know, the cath support, my vein where my catheter, my port is located, it collapsed. I had to have angioplasty last year. That put my treatment plan back. So, I mean, you just have grace and space for yourself and ask plenty of questions.
Absolutely. Yes. Thank you, Lashelle. And I think I see also Rila put in a comment too in the chat about telling her survivor sisters to record your appointments on your cell phone, you know, looking at those medical notes to also continue to be involved in their treatment plan. So that's another additional recommendation. Dr. Fay, I didn't know if you had anything you wanted to share as a takeaway from this conversation that you'd like to also add to those who are on the line.
I just want to reiterate. So I noticed the themes, I came in and I presented and I, said certain things that I had noticed. And then when each of you spoke, you resonated what I said. And I feel like it's so important. We're all having these similar experiences. One is, oh, we only get a few days, or there was too overwhelming, too much on my mind to even think about fertility. Those are so common amongst the community that I feel like we really need to advocate for. These conversations need to happen often. We need more time. We need all of the information, and we need it, not just one day before we have to make that final decision. So everything that everyone is saying here it's so important for us to realize this is real. These are issues that are happening, and you cannot expect someone to make a decision on something that could change the trajectory of their entire life in 24 hours. So I'm walking away thinking that, you're resonating and you are, in solidarity with so many other women that this just needs to change.
Absolutely. Thank you, Dr. Fay, for sharing that too. And I just wanted to share my screen to be able to, because I know these phenomenal women, this conversation, it continues and their journey continues. And I want to thank you all for opening up. It takes emotionally being able to share all this information and being able to share this part of yourself. And my hope and my desire too is that you're filled and that your cup is filled as well as you leave this space. And that you know that you are part of a community that supports you, that we are here for you if you have questions, if there are different things along the way. Like Lashelle said, she was able to learn so much and be able to advocate, like Rila said, finding her voice and being able to share it through this journey. If there's anything that you need in terms of resources or what can help you to continue to find that hope or continue to push that hope forward, we are here for you. Our community is here for you. And I'd also like to share my screen just to share with those that are on how you can keep in touch with these phenomenal women. Please take a screenshot of their Instagram handles. Cotilya, breast cancer doesn't have me, Lashelle, Senator North Star 2021, and Morgan, the scientist. Please follow them as well and continue the conversation. Give them a, give them a shout out, as well as being able to, continue with them and speak with them. And as well, you can continue to find us on Instagram, Tigerlily_Foundation. As also, if you are part of the conversation and you would like to drop your email address as well in the chat, if you want to continue with some of the patient experts on, please feel free to do that. Thank you all so much. I'm going to stop sharing my screen. Thank you for being a part of this conversation today. Happy St. Patty's Day and happy March and almost spring. Spring's in a few days. So sending you all so much love, light, prayers, good vibes, that your day, your week will be filled and encouraged by being in this space with these women who have shared with you. Sending you all the best. Have a great, blessed day. Thank you all.
Thank you for having me.
Thank you. Bye-bye.
Bye. Thank you, guys.
Thank you.
Thank you, everyone.